you have been recommended for advice re-surgery I have had done. I had an FDL, that's a Fleur de Lis tummy tuck, 21 weeks ago and have excess skin still. I also have a dimple above my tummy button that prevents full movement. I can only describe a feeling inside as a cat's tongue. I had breast augmentation uplift and implants 9 weeks ago and also not happy with this procedure. I had an arm lift and have been left with what can only be described as, anyway, an unsightly looking bit of skin in my arm pit. I would really appreciate it if you would look at my pictures and advise. I have done so. I have looked at the pictures and advised, but I said that I would talk about it here. So there's a few things to talk about here. This is quite a lot of surgery. 21 weeks ago is a Fleur de Lis tummy tuck, and then 9 weeks ago is a breast augmentation uplift, and also an arm lift. I mean, that's a lot. Whoa, that's a massive amount of surgery. Point one. Point two, it's not really a point. Well, it is a point, but it's not really I guess it's not that relevant, but it is. But the point two is that it is all quite recent, 21 weeks. She has shown me photos of the results, and there is some excess skin. So we'll go through the problems. Dimple above my belly button that prevents full movement, and also there was a problem with the skin above the, excess skin. The excess skin is in the upper part of the abdomen. I've spoken about this before. It's always a problem with tummy tuck, the skin above the belly button. Now it does get pulled down, but when you have a Fleur de Lis tummy tuck, that usually means you've got an extreme amount of weight loss. It's for people who've had significant weight loss with a significant amount of excess skin. And so a tummy tuck, whatever type of tummy tuck, Fleur de Lis or a standard full tummy tuck or whatever, or a mini tummy tuck, whatever, they all address the skin below the belly button. The skin below the belly button is usually where the real excess is, and the excess from the belly button up is always less than the belly button down. The main problem is this lower abdominal skin and fat, and that is what is addressed with a tummy tuck. So when you do stuff to the tummy, that's where you're really tightening it, and you do it by taking all that skin away and then pulling it down, the skin from above. Oh, Barbara. Oh, do you need the notes? Sorry, I would have bought them. Yeah, it's all done. It's all done. Yeah, thanks. So the lower abdominal skin is what you really focus on. It does help the upper abdominal skin because you're pulling it down to close the abdomen, but it doesn't directly address the upper abdominal skin. So if you have significant excess in the upper and lower abdomen, you may still have excess skin in the upper abdomen after a tummy tuck. And it's like anything in this world, ideally, this is something that you need to really hopefully have been spoken to about prior to having the surgery, because you might have the surgeon saying, hold on a minute, what's going up here? The surgery really addresses the lower abdomen. So if there's loads of excess in the upper abdomen, it will be improved, but it might not be as drum tight as you might want it. The other thing with any tummy tuck is we are trying to make it as tight as we want, because we want to give you a great result and we want to give you a tummy that's as tight as a drum, but you don't want the wounds to not heal up. So there's a balance there. So you're always, you want good wound healing. I think this patient had quite nice scars and nice wound healing and everything. So there's a balance there. You've got really nice wound healing, but you're like, oh, I've got excess skin. It is an art, not a science, and we try not to take away too much, because if you take away too much, then oh God, can I do that in a minute? Oh, sorry. If you take away too much, the wounds don't heal up, and that's even worse. So, so the answer is, if you do have excess skin in the upper abdomen, you might need another operation known as a reverse abdominoplasty. The problem comes with all of these things is whether that's a revision or not, because people, if they felt that that was going to have been addressed at the time of surgery, might rightly think that should be a revision, i.e. I shouldn't have to pay for it. And then you might find a surgeon who says, well, it's a different operation because that's the, it's another big operation and you have to pay for it. And you know, really it's about trying to not educate, but explain to patients about pre-op what can be achieved with a tummy tuck, and say to them that you might not get the upper abdominal skin, you might have a bit of laxity there, in which case you might need another operation, and you have to pay again if you have that other operation, and then they can decide whether to have the surgery or not. But I must say, a reverse tummy tuck is only rarely needed. It's only if you've got loads and loads of excess skin, because the full tummy tuck might not get all of that excess skin tightened. So the dimple above the tummy button. Now, I think this is because it was a Fleur de Lis tummy tuck. A Fleur de Lis tummy tuck gives a reverse T-shaped scar. So the scar goes above the belly button, goes straight up and down, and meets the normal tummy tuck incision. So it gives like a reverse T, or an anchor, a bit like a mastopex, I suppose. So the dimple might be the dimpling of the scarring. I think it's the scarring pulling in. 21 weeks is early days. Get massaging it and what have you, but sometimes scars can dimple in, and it's one of the problems with the Fleur de Lis tummy tuck, but it does give you that scar going up above the belly button, straight up above the belly button, well, and below, sort of. I'm not sure the feeling inside is a cat's tongue. Not sure about that one. Don't know what the cat's tongue feeling is really. Breast uplift and implants 9 weeks. This is the same patient now, and also not happy with this procedure. An arm lift described as a funny thing in the armpit. Now the thing in the armpit, what they're talking about, when you do an arm lift, you make a big scar on here, and sometimes make a little L, or sometimes you do a T. It's okay. It's okay. You can walk past. You're right. You need me. No. Because, and the reason you do that sort of the extension into the armpit is because you're trying to stop having a dog ear. A dog ear is a bump. Whenever you cut skin out, you get a bump, and you try and create that dog ear up into your armpit. And the thing that you're describing, the look of your armpit, is sort of it's a bit sort of puckered in, because I think what they're trying to do, it wasn't me, but I'm imagining the surgeon was trying to do is trying to avoid a dog ear. And so when you're trying to avoid a dog ear, you sometimes get a bit of dimpling. You're right, Dave, it's all right. And that's what it looks like, but you are trying to avoid dog ears, particularly down around your elbow. So although it might look a bit unsightly in your armpit, you have to sort of lift your armpit up to see it. Again, it's a bit difficult for me to explain, just sort of explaining away all this stuff, because I need to see a surgeon and they should sort of explain what's going on. But I've got to say, the results of the surgery were, I would say, sort of within normal limits. And I think a lot of the unhappiness might be coming from what you expected it to be like, and what maybe I don't know what the surgeon expected, but I didn't see the pre-op, so you have to look always, whenever you do post-ops, you have to sort of take it in context of the pre-op. But I think these things do happen when you have these sorts of big operations, and there are risks and things might not look right. But again, 21 weeks and 9 weeks post-op, give it time to settle is my advice. At least sort of minimum, I would say, is 3 months, ideally 12 months, but certainly around sort of 6-7 months time. If things aren't settling, then you could consider something, I don't know, maybe a reverse abdominoplasty or something. But for me, I think it all looked like it healed well, and you hadn't had complications, because that's the problem with these operations. Fleur de Lis abdominoplasty, breast lift with implants, arm lift, these have got a huge risk of complications, wound breakdowns, infections, what have you. So I know you're unhappy with the result, which is miserable, because I'm sure it cost an absolute fortune to have all that surgery. But you've healed well, you haven't had complications, and maybe that's not much solace thinking about it. Anyway, but yeah, thanks very much for the question, and I hope that's been helpful. So look at that, we've got some comments live comments here.